Synovitis. How do we treat it? In the last post, we talked about the causes of synovitis, or inflammation of the lining of the joint. Now I'm going to talk about treatment. So the first cause was osteoarthritis. Typically, the treatment is to get the inflammation down. It might be by anti-inflammatory medications by mouth. It might be by a cortisone injection. It might be by hyaluronic acid injections. Unfortunately, cortisone injections are known to damage cartilage, and anti-inflammatories can bother people's stomachs. So a lot of times we'll use regenerative medicine techniques like PRP, platelet-rich plasma, and bone marrow aspirate cells, which has stem cells and other cells that help the stem cells, as well as laser therapy to decrease that inflammation. So rheumatoid arthritis is an autoimmune disease where the body attacks its own cartilage. So there are medications that can slow that immunologic process down. They do make people more at risk for infection and wound healing problems. So regenerative medicine techniques also help for that because they don't have the side effects. Laser is another amazing technique to decrease the inflammation in rheumatoid arthritis without all the nasty side effects that the medications can have. Synovitis after an injury or trauma or overuse basically is the same process. There's inflammation in there, and there are the standard treatments like the anti-inflammatories by mouth. There's the cortisone, there's the gel injections. We still love laser, no needles, no shots, no side effects, decreases inflammation, increases blood flow, helps get that swelling out of there. And then the PRP, platelet-rich plasma, the bone marrow aspirate cells, we love those as well. And let's not forget strengthening the muscles. The stronger the muscles are on either side, the less force is going to go across that inflamed joint and the inflammation is going to go down. Gout results in uric acid crystals building up in the joint, which causes inflammation. Pseudogout is calcium crystals. Gout can be treated with various medications and also changes in diet a lot of times. Gout and pseudogout can also be treated by the standard treatments I talked about, but we also like to use the regenerative treatments like laser and PRP and bone marrow aspirate cells. Infection can also cause inflammation or synovitis of the joint, but that usually needs surgery to drain it, usually wash it out, and then IV antibiotics. Sometimes after surgery, post-surgical, or after an injection, the trauma from the surgery or the injection can cause some irritation and inflammation in the joint. That's usually going to get better on its own. But if we're injecting PRP or bone marrow or using laser, that's going to decrease the inflammation. PVNS, or pigmented villonodular synovitis. That's a benign buildup of synovium, swelling, inflammation in the joint. We don't really know exactly what causes it. A lot of times that requires going in surgically and performing a synovectomy where we have to shave all this away. Hemophilia or other bleeding disorders that cause bleeding into the joint. Believe it or not, blood causes inflammation, so repeated bleeding into the joint will cause inflammation and thickening of the lining of the joint. And again, sometimes that requires shaving it away. Any of these things where the synovitis becomes chronic and thickened and unresponsive to conservative treatments, sometimes we'll need arthroscopic treatment where we go in and we shave it away and get rid of it.